The Affordable Care Act. The current impact of the Affordable Care Act on healthcare access, cost, and quality, presented by Yvette Brown, Jenny Graves, Neola Jordan, Shobana Nandakumar, and Felicia Ward, University of Maryland, University College, Graduate School of Management, Class HCAD 620. The Patient Protection and Affordable Care Act, also known as the Obamacare, is a healthcare reform law passed by President Obama in 2010. The Affordable Care Act is very complex. It is a long-term healthcare reform law set in place to improve the quality of healthcare. The law eliminates many of the high costs associated with healthcare and is intended to improve the accessibility to healthcare. What is the Affordable Care Act? The ACA determines how healthcare is delivered within the United States. High premiums and out-of-pocket costs has been a major problem. ACA is in place to relieve some of the burdens associated with cost. Rules and regulations are set in place to make healthcare affordable for all Americans. The Affordable Care Act gives consumers the choice to have health insurance and to be in charge of their health care. The Affordable Care Act is set up to give millions of Americans access to better health care. New rules and boundaries are set for insurance companies, businesses, tax credits, and other healthcare programs. The law was designed to improve healthcare within America. However, there were many problems within the government and the public accepting ACA. The law does not force anyone to buy health insurance, but if they do not purchase health insurance, then they may face penalties. Who is newly covered? The Affordable Care Act requires all Americans to have access to health care, coverage for young adults to age 26 under parents' policy, no more denial of coverage for pre-existing conditions, federal subsidies for those unable to afford health insurance, employer-based health coverage mandated for 50 or more full-time employees. Many Americans fell through the cracks of being eligible for health insurance. Unemployed adults with no chronic disease, small group employers, and individuals who don't meet Medicaid, Medicare coverage. How is the ACA coverage achieved? Federal intervention expands insurance coverage, holds insurance companies accountable in a federal effort to reduce healthcare costs, guarantee more choice, and promote preventive care. What does the Medicaid program have to do with the Affordable Care Act? Historically, only low income children, pregnant women, elderly, and disabled individuals and certain parents were covered, everyone else was excluded. Affordable Care Act expanded Medicaid coverage in 2014. Adults under 65 with incomes up to 13% are eligible. States have the option if they would like to participate in the expansion or not. The Affordable Care Act promotes Medicaid enrollment. In 2014, Medicaid and Children's Health Improvement Program had increased by 4.8 million. States that participated in the Medicaid expansion had an enrollment growth of 12.9% for low-income adults, which is greater than the national average. States that did not participate in the expansion had an enrollment growth rate of 2.5%. What are exchanges and how are different states approaching them? Exchanges online marketplace to shop for health insurance. States have choices in establishing and running exchanges. Each state is responsible for establishing exchanges. States can develop state-based exchanges or may choose their exchanges to be federally run. How do states approach the Affordable Care Act exchange mandate? Early adapters, pragmatists, passive resistors, active resistors. New, simpler methods of enrolling. Historically, each state had their own method of enrolling. Would need to enroll in person? Currently, all states must offer multiple methods of enrolling, either by phone, mail, or online. Electronic verification is done in real time. Applicants are notified instantly of their eligibility. Enrolling. No wrong door enrollment system. Each individual who applies through Medicaid or Marketplace will be enrolled in a program that he or she is eligible for. Enrollment period is year round. Effects of the Affordable Care Act on health insurance premiums. Insurance premiums increase due to the Affordable Care Act, increase due to insurance companies having to accept enrollees despite pre-existing conditions, significant increase in premiums 2010 through 2014. Increase slowed down in 2015. Average premiums only increased by 4%. Some large cities had a decrease in overall premiums. Out-of-pocket expense for services could be lowered if enrolled a state health insurance marketplace. Effects of the ACA on the rates of uninsured working adults. Rates of uninsured working adults reduced from 20% in 2012 to 16% in 2014. The number of people who could not receive health service due to costs reduced from 43% in 2012 to 36% in 2014. What variables are in play in the political debate? The impact of the ACA on cost, access, and quality of care. Elimination of the mandate to require every individual to have health care to voluntary. This could create an environment where healthy people would leave the exchange and purchase health insurance only when needed, therefore increasing the cost of premiums on the exchange for others. Implementations of the ACA is the beginning of the socialist medical infrastructure and will add to the nation debt. Variables in political debate. Affordable Care Act High Cost Plan Tax, HCPT, sometimes called the Cadillac Plan Tax, affecting employees' decision about their health benefits offered to their employees in 2018. The HCPT is to intend to discourage employers from offering overly generous benefits plans and to help to contain healthcare spending. The 2018 thresholds are 10,200 for self-only coverage and 27,500 for other than self-only coverage, and rates may increase annually with inflation. The amount of the tax is 40% of the difference between the total cost of health benefits for an employee in a year and the threshold amount for that year. Variables in political debate. Alternative payment structures other than the fee-for-service to decrease costs, evidence-based medicine research to improve on standards of care and improve quality of care, continued incentive program for implementation of the electronic health record to improve in accessibility to care, coordination, and quality of care. What are some of the key implementation challenges still facing state and national policymakers? Expansion of Medicaid program is optional for states. 26 of the USA states elected not to expand Medicaid coverage. Potential eligible individuals left uninsured. Creation of a product that is affordable. This is especially a concern for low-income individuals and families where they are faced with premiums and co-payments. Some states are considering offering subsidies to individuals to help with out-of-pocket expense for low-income individuals. Narrow provider networks to contain costs. Challenges still facing state and national policymakers. Coverage issues due to the life event and fluctuation in income. Many of the subscribers shift between Medicaid and subsidized exchange coverage. Maldistribution of primary care providers in geographic areas. The lack of primary care providers in rural and some urban areas. the lack of medical students selecting primary healthcare as their field of study. Political sustainability. Opposition still exists attempting to repeal the Affordable Care Act. Improving the level of integration between Medicaid and health insurance marketplace enrollment system, a single unified system that provides integrates the determination and redetermination process. Please view this video about the challenges of the Affordable Care Act. On balance, is the Affordable Care Act a good or bad law? The Affordable Care Act is a collection of two medical acts in the United States. These are Patient Protection Act and the Healthcare Education Reconciliation Act. This provides a comprehensive health insurance that will hold insurance companies accountable in health matters, lower the health costs, and improve quality by guaranteeing choice. ACA, a good or bad law? This is a good law for the country. Healthcare should be affordable as a fundamental right by all citizens, irrespective of age and income. Prevention of disease is another aspect that this healthcare covers. Youth in school, pregnant women, and young adults are covered. A plus for the Affordable Care Act is that it covers people with pre-existing conditions. In conclusion, the Affordable Care Act was designed to improve healthcare, aiming to improve the quality of care. Improvements have been made to make healthcare more affordable and accessible. Medicaid, Medicare programs, and other programs associated with healthcare system has improved this access. The Affordable Care Act covers many entities. Some people might find the Affordable Care Act to be an improvement to healthcare, while others might find it risky. Affordable Care Act has changed how healthcare is delivered and administered within the U.S. Thank you for watching this presentation. We hope that you enjoyed.